Minister, across the country, thousands of people have died from a toxic drug crisis, including young people. 2 17-year-olds died yesterday in my community of Courtenay-Alberni from a toxic drug crisis. Family members, workers, loved ones are dying because of the toxic opioids that are on our streets. Now, we learned that McKinsey and company received millions of dollars from your government, as we know. This is a company that settled on an $800 million lawsuit for their role in the opioid epidemic in the United States. What's the threshold for your government for companies that are that have been embroiled in scandal? And I'm not going to put it all on McKinsey, the toxic drug crisis, because your government's taken an incremental approach to this health crisis. Incrementalism kills when it comes to a health crisis. The Conservatives spread misinformation. Misinformation kills people in a deadly health crisis as well. I want to know what your threshold is. Or you're contributing to it.
Point of order, Chair. Is this the gong show that's going to go on here today?
Yeah,
I'd invite through you, Mr. Chair, Mr. Johns, to withdraw that assertion.
I was already
Okay,
reaching for Mike to state that. That was very.
I'll withdraw.
I appreciate where you're getting at, Mr. Johns, but it's very inappropriate.
Your leader's not very classy either. Sorry.
Sorry, Mr. Johns.
Well,
please.
I'm getting chirped at.
Okay,
I'm getting chirped at.
Okay, Mr. Barrett, Mr. Johns, please. We've been very working well together with this. I would ask you to please apologize, Mr. Barrett, for the comment about killing people. That's very inappropriate.
I didn't appreciate the also the being chirped at while I'm trying to ask questions.
Mr. Johns,
I'll apologize for that comment.
I will follow up to make sure that we all respect each other's time.
The apology is forthcoming?
The apology is right now, Mr. Barrett.
Thank you. Please, no more of this. Please, thank you very much. Continue, Mr. Johns.
I mean, I find it ironic that your government is investing $33 million in the substance use assistance program, and McKinsey's getting $32.5 million in contracts from your government. Do you feel that as a public safety minister that if there was toxic alcohol or toxic lettuce or toxic Tylenol that it would be your job to step in and do something about it?
First, Mr. Johns, I want to be clear that I would hope that all parliamentarians are united in tackling the opioid crisis and indeed all of the public health concerns that revolve around substance abuse. That is one of the reasons why this government has been working around the clock to finalize a new healthcare agreement with provinces and territories that will amount approximately $198 billion, which is why we are taking additional steps to take a public healthcare approach to the challenge of the opioid crisis, including in your home province of British Columbia, where we have a very good collaboration with the EB government. So, Mr. Johns, I'm just going some way here to assure you that this is a government that believes in taking
Minister,
a patient-centered,
$33 million a year,
trauma-informed approach.
$33 million a year is not urgency. This is the leading cause of death in my province, more than homicide, motor vehicle accidents, death by suicide. You're the public safety minister. You are the public safety minister. You ignored your own expert task force on substance use that made recommendations to your government. I put it forward in a bill. You voted against it. You voted against your own expert task force. You know, there is no detox in my community. There's no treatment center in my community. I was at the Parksville Recovery Center. They're doing bake sales to keep their doors open. These 2 young boys died. I got a message from their counselor. And she said, I'm so sad and frustrated. They barely had a fighting chance, but there were moments that he did fight, and he certainly loved. When will your government fight to be there when people are ready? When will you show the love and compassion that's needed in this crisis? You are the public safety minister.
We're going to fight every single day by taking the appropriate evidence-based and compassionate approach to supporting everyone who suffers from substance issues. And Mr. Johns, don't doubt it for a moment. I understand your pleas, and we will work with you. We'll work with your community. We'll work with the advocates in this space. We'll work with the government of British Columbia. We'll work with all of our provincial and territorial partners.
You voted against MP Brandon Henley. He was the former chief medical health officer of the Yukon who supported my bill. You voted against your own expert.
And we're doing, nonetheless, the work with the province of British Columbia to push forward with a public health care evidence-based approach to tackle this crisis around the opioid substance abuse challenges that are felt by you, your community, and right across the country. That is the commitment and the track record of this government. Yes, it's hard. Yes, it's challenging. Yes, there are real human losses and tragedies that go along with that, but we will do this work together.